The health inequities refer to the patterning of health across population groups. It can be by race, by income, by gender, by sexuality, but it refers to enduring and reproduced historically differences in health, so that some populations are over time less healthy than others. The first approach to solving health inequities is to identify them, to measure them, and to talk about them. And that's always a key part of what we do in public health. This department is a source of a wealth of information about the health of populations. And since I've been commissioner, we have taken it upon ourselves to name these differences in community health and to talk about them. In this city, we see the biggest divisions by health, by race and ethnicity. So this has to do with the problem of racism. And it's very important for us to name the problem of racism, both individual and, most importantly, institutional, and to pursue racial justice as part of our work at the Health Department.
At the Center for Health Equity, we have 4 approaches to advance health equity. 1, we work to support the Health Department's work around internal reform so that we can become a racial just organization. 2, we work to build partnerships with outside organizations and city agencies to advance social justice. 3, we work to make injustice visible through our data and storytelling. And 4, we invest in key neighborhoods that we know historically have been deprived of resources due to practices and policies that have supported residential segregation and other forms of discrimination.
The ultimate goal for the Center for Health Equity and addressing the social determinants of health within New York City is to create a consciousness in neighborhoods that doesn't exist right now when people are thinking about health. The traditional conversations in health in a neighborhood perspective, in a place-based perspective, revolves around the health system. We need new hospitals, we need new clinics, we need more doctors. That is something that we're not saying is not important, but we're also saying, why do you want more doctors? Why do you want new hospitals? There are reasons why certain neighborhoods in New York City are unfortunately sicker than others, and we as a division are here to highlight and illuminate the causation to why certain health inequities exist. We are also going to be unafraid of mentioning how certain decisions are made in communities that are not taking into account the public health impact. If we can create a consciousness with city officials, with businesses, with community-based organizations when they're thinking about planning and designing a neighborhood, that consider public health, not just the healthcare system in that decision-making process.
One of the ways that elevating voices of our community residents and really valuing their expertise was through one of our planning processes that we went through in Brownsville, Brooklyn, in which the residents were calling upon us to say, you know, we want to ride bikes, we would like to walk, but the reality is it's not safe enough to do so. Over a process of 4 years, the community, along with all of us at DOH, at the Health Department, at Department of Transportation, created a plan that not only were we going to put 7 miles of bike lanes, which was initially proposed, but we actually put 28 miles of bike lanes down. And this was all at the asking of our community partners and community leaders.
The Brownsville Bicycle Lane project came about as a result of a request by community residents for safer biking conditions. And as district manager of Community Board 16, it's my responsibility to interact with the various city agencies to resolve concerns of the community.
I love biking, I love outside. I really would like to see more people in my category do more for themselves and become well and fit and feel better and not have to take so much medicine.
So we work with a lot of different neighborhood groups and residents and elected officials and pretty much anyone who wants to work with us on improving the health of the South Bronx. Urban Health Plan is a neighborhood health clinic. Along with us, they've identified several corner stores, or bodegas as we call them in New York, and they work with the local bodegas to make sure that the bodegas have offerings that are a little bit more on the healthy side than what they might have offered previously. Our ultimate goal would be that no matter where a young person grows up in New York City, they've got the same opportunity to grow up as a healthy human being as anywhere else in the city.
One of the most biggest changes I've seen with Shop Healthy Bronx is the interest level, not only of community residents, but of practitioners in urban health centers that want to get involved, and also the demand for healthier options and wanting to get to taste different foods too.
Yeah, so happy because when Shop Healthy here, now we change our daily department, do so many salad, and when you buy a salad, we give our water, the fruit. The customer is so happy for that because you have more things for less money. Everything healthy.
It's important that neighborhoods that over time are less healthy than others not be seen as neighborhoods that are simply needy neighborhoods. These are neighborhoods that have been rendered unhealthy by bad policies, by lack of access to fair wages and affordable housing, all things that are priorities of the current administration.
In the city of New York, there's a lot of planning efforts going on in a number of neighborhoods across the city. And those planning efforts include city agencies such as the New York City Department of City Planning, New York City Economic Development Corporation. And we're working with those groups to see their role in planning in a neighborhood as having a public health impact.
One of the opportunities that we have at the Center for Health Equity, I believe, is innovation around communications and really using it as a tool to share what's going on in our city, but also to capitalize on what other people are doing. And so we need to be comfortable as a health department in using hashtags and handles and Twitter and Instagram. And it's not considered a barrier, but it's considered an opportunity.
This is something that affects all of us. And we as a city, myself as Health Commissioner, are committed to viewing it as something that we have a collective responsibility to address. The health equity of our city is something that will make us a stronger, healthier city, and that will make everyone's life better.